So as you can see, we have many trays. So these ones are for hip replacement, and these ones are for knee replacement. So we have all the implants we need for the cup, for the stem, for the cement, for the part of the knee, the kneecaps. All these are here. An orthopedic surgeon does 3 cases a day. For example, you do 3 total hip replacement in 1 day. So that means in 1 year, 40 days at 3 cases a day, I was doing approximately 120 surgery a year. Since I'm private, I do approximately 300 surgery a year. A place like here could probably do like 1,200 hip replacement a year. Then the impact on the wait list in other hospitals could be significant. But it needs to be a political decision. You need to have the will to really solve the problem, and you have to look at it from the cost point of view, which is very important because, of course, it costs a lot of money to take care of patients, but also from the quality of life patients get. Hip and knee replacement, people don't die from pain. They're miserable because they have pain, they can't walk, they can't travel, but they're not dying. And hospitals, I believe, are mostly for people who need to be saved from cancer or heart disease or condition where you may die. So maybe it's a good moment to make decision to keep sick people in hospital and offer other types of buildings to provide care to people that are not sick but are suffering. And the job of the orthopedic surgeon is the suffering one. So the true impact of what I'm doing right now privately is probably low on the wait list. But if eventually, like in most of the other countries, people can choose where they're going to have surgery, especially in the context that the government is going to come with a standard price for joint replacement in Quebec province. Whether that cost is in a public or private hospital, it doesn't really care. If it's $14,000 for hip replacement in a public hospital or $14,000 in a private hospital, I don't see why it would make so much difference. Then the impact could be very significant because people would choose where they would go. And I have a tendency to believe that a lot of patients would choose a place like here because it's clean, so there are less infection, but mostly because it's specialized.